I'm Catherine Law. I lead the communications team at the National Center for Complementary and Integrative Health, or NCCIH, at the National Institutes of Health. On behalf of the NCCIH Director, Dr. Alain Langevin, and our Deputy Director, Dr. David Shurtleff, I want to welcome you to our Integrative Medicine Research Lecture Series for a presentation by Dr. Christopher McCurdy from the University of Florida. His talk is entitled, "Can a Controversial Treat Help End the Opioid Crisis?" I am now pleased to turn things over to the NCCIH Deputy Director, Dr. David Shurtleff, who will introduce our speaker. Dr. Shurtleff.
Well, thank you, Catherine. Welcome, everyone. Welcome to the first lecture series for the spring 2021 in NCCIH Integrative Medicine Research Lecture Series. We're pleased that Dr. Christopher McCurdy and our viewing audience could join us today. Our lecture today reflects several key research interests to NCCIH, including complementary and integrative approaches to help treat opioid misuse addiction and support recovery, approaches to enhance the management of chronic pain, which is frequently comorbid with problems of opiate use disorder, and to develop tools, models, measures, and methodologies to advance the scientific study of natural products. You can find many of these topics outlined in our FY fiscal years 2021 to 2025 strategic plan, and I hope you will take a look at that. Now it's my pleasure to introduce today's speaker. Dr. Christopher McCurdy is a broadly trained medicinal chemist, behavioral pharmacologist, and pharmacist whose research focuses on the design, synthesis, and development of drugs to treat pain and drug abuse. He received his PhD in medicinal chemistry from the University of Georgia and completed postdoctoral training at the University of Minnesota. Dr. McCurdy is currently professor of medicinal chemistry and the Frank A. Duckworth Eminent Scholar Chair, director of the UF Translational Drug Development Corps at the University of Florida. For over 20 years, much of his research is focused on opioids, neuropeptide FF, and sigma receptor ligand, probe design, synthesis, pharmacological evaluation, and development. Most notably, he has developed a PET MRI diagnostic agent for visualizing the origins of chronic neuropathic pain by interacting with sigma receptors at the site of nerve damage. Dr. McCurdy is also internationally recognized expert on kratom, the topic of today, that is under investigation for opioid withdrawal. Dr. McCurdy previously served as president of the American Association for some Pharmaceutical Sciences and also serves as the co-chair of the Special Interest Group on Drug Design and Discovery of the International Pharmaceutical Federation. He was also past director of the NIH COBRI Center for Research Excellence in Natural Products Neuroscience. Dr. McCurdy receives NIH funding from the National Institute on Drug Abuse and the National Institute on Neurological Disorders and Stroke. And with that, Chris, we very much look forward to your presentation, and I'll turn the mic over to you.